If you've ever been to a chiropractor, a physical therapist, or even a massage therapist, there's a pretty good chance you've been told that you have one leg that's just a little bit shorter than the other.
You have short legs.
What?
Hi, I'm Dr. V. Most of my new patients are surprised to learn when I tell them that they have one leg that's a little bit shorter than the other. Now, this is extremely common. In fact, it's one of the first things that most, if not all, chiropractors will check on every visit. Many of the chiropractic techniques, in fact, begin with evaluating leg length discrepancies because this tells us a lot of information of what we can expect to see with the biomechanics of the body. Now, I should mention there are two main types of short leg presentations that we'll typically see in practice. One is an actual short leg where there is, in fact, a measurable difference between the two. One bone, for example, this femur, might actually be just a little bit shorter than the femur on the other side. Now, there are several reasons why this can happen, including injuries or infections during the growth phase when you were a child, or even as a result of a surgical procedure. In these cases, a simple shoe lift to balance things out may be all that's needed. If it's significant enough, surgery may be an option. Now, true anatomical short legs are not that rare, but they're also not as common as a functional short leg. Now, these are extremely common, and the interesting thing about functional short legs is that it's not actually short at all. The legs are equal length, but one leg will tend to sit higher up than the other due to a postural imbalance in the musculoskeletal system. In other words, that for whatever reason, there is a misalignment in the hips and spine, preventing the normal movement of the joints. Now, this is important to you because misalignments create additional stress and strain, resulting in inflammation, chronic pain, and not to mention early wear and tear in the joints. So checking leg lengths is just one of the many tools we use to identify biomechanical issues in the body. In fact, I personally check them several times before, during, and after the treatment. So how do you know if you're out of alignment? Well, you may notice one hip feel a little higher than the other, especially when you're standing. You might lean more to one side while sitting or standing, or your shoes can even clue you into how your alignment is, because you'll notice this uneven wear on the bottom of your shoes. Of course, your local family chiropractor can tell you exactly what's going on with your posture and help you regain and maintain that proper alignment.
You gotta go to my chiropractor. He's the best.
Well, now you know why chiropractors are always checking leg lengths. That's all I have for this video. I hope you found it informative. Take care of your spine, and I'll see you back next time.